Bodybuilding showcases dedication, discipline, and strength. People often link big muscles with peak health. But is this always the complete picture? Sometimes what we see on the surface doesn't tell the whole story about health. Beneath the sculpted physiques, a hidden risk may lurk. This risk involves the cardiovascular system. The heart, our body's engine, can face undue stress. Recently, a new study has brought this issue to light. Dr. Marco Viciato, a respected cardiologist, led this research. His team looked closely at the hearts of bodybuilders. Their findings, published in a prominent medical journal, are significant. This study is causing many to rethink bodybuilding's impact. It highlights concerns that have been whispered about. Now we have more concrete data to consider. This research provides a vital wake-up call for the community. Understanding these findings is the first step. The primary aim of Dr. Viciato's study was clear. It sought to investigate specific cardiac changes in bodybuilders. Dr. Viciato's study presented some unsettling conclusions. The research involved bodybuilders compared to non-bodybuilders. Various heart health markers were measured. Blood pressure and arterial stiffness were key factors. A major highlight was the increased risk of sudden cardiac death, especially for those using certain methods. Enlarged heart chambers were noted, known as cardiac hypertrophy. This condition can increase the risk of arrhythmias. A notable percentage showed adverse changes, especially those using performance-enhancing drugs. The findings suggest a pattern that needs to be addressed. One key factor is the sheer amount of muscle mass. Carrying extreme levels of muscle is demanding. The heart has to work much harder to supply blood. This blood needs to oxygenate all that tissue. Over time, this constant high demand can strain the heart. It's like an engine constantly running at high RPMs. This can lead to the heart muscle thickening. This is called left ventricular hypertrophy, or LVH. LVH can be a precursor to more serious heart problems. Intense training regimens also play a significant role. Bodybuilders often lift extremely heavy weights. They engage in prolonged, high-intensity workouts. This type of training causes sharp spikes in blood pressure. Repeatedly subjecting the heart to this is stressful. The cardiovascular system is pushed to its limits daily. Rapid weight loss strategies are another concern. Many bodybuilders cut weight drastically before competitions. They aim for extremely low body fat percentages. This often involves severe calorie restriction and dehydration. These combined factors can lead to significant heart changes. Understanding these mechanisms is key to prevention. The danger within anabolic steroids and heart damage. Anabolic androgenic steroids, or AAS, are a major culprit. These synthetic hormones are widely used to build muscle. However, their impact on the heart is devastating. Steroids can directly damage heart muscle cells. They contribute significantly to left ventricular hypertrophy. This isn't the healthy kind of heart adaptation. It's a pathological thickening that impairs function. The heart becomes less elastic and pumps less effectively. Steroids also accelerate atherosclerosis. This is the buildup of plaque in the arteries. Plaque narrows the arteries, restricting blood flow. This can lead to coronary artery disease. AAS can also alter cholesterol levels negatively. They raise bad LDL cholesterol and lower good HDL cholesterol. Other performance-enhancing drugs, or PEDs, add to the risk. Growth hormone, often used with steroids, can enlarge the heart. Insulin, misused for muscle growth, can cause dangerous hypoglycemia. The cocktail of multiple PEDs is especially dangerous. The evidence against PEDs is overwhelming. Professional versus amateur, a difference in risk. Professional bodybuilders face higher risks. They push their bodies further. The pressures to win are immense. This leads to extreme training practices. Higher doses of PEDs are common. Amateurs are not immune to these risks. Many aspire to reach professional levels. They emulate pros training and drug protocols. The potential for harm is real. Awareness is crucial for all bodybuilders. More than muscle, broader health and psychological burdens. The health impact of PEDs extends beyond the heart. The liver is particularly vulnerable to damage. Oral anabolic steroids are known to be hepatotoxic. This means they can cause liver inflammation and tumors. Kidney function can also be impaired over time. High protein intake, combined with PEDs, strains the kidneys. The endocrine system is severely disrupted by steroid use. Natural testosterone production can shut down. This can lead to infertility and other hormonal issues. Psychological challenges are also very common among bodybuilders. Body dysmorphic disorder, or BDD, is prevalent. This is a condition where individuals obsess over perceived flaws. They may see themselves as small, even when very muscular. This can fuel an unhealthy obsession with size. It can drive the continuous use of PEDs. Addiction to training and PEDs is another serious concern. The fear of losing muscle can be overwhelming. This creates a cycle that is hard to break. The pressure to maintain a certain physique is immense. This pressure comes from competitions, social media, and peers. Building a safer future. Healthier practices and systemic change. Safer training practices are essential for longevity. Moderation is key in training intensity and volume. Listening to your body is incredibly important. Proper nutrition, focusing on whole foods, is vital. Adequate rest and recovery should be prioritized. These allow the body, including the heart, to repair. Avoiding extreme rapid weight loss methods is crucial. A slower, more sustainable approach is always better. Regular medical checkups are non-negotiable. This is especially true for serious bodybuilders. Routine cardiac screenings can detect early warning signs. Echocardiograms can assess heart structure and function. Blood tests can monitor cholesterol, liver, and kidney health. Working with knowledgeable healthcare providers is important. Doctors can offer guidance on safe training limits. They can also help manage any existing health conditions. Early detection and intervention can save lives. We need stricter anti-doping regulations in bodybuilding. More frequent and comprehensive testing is required. Education about the dangers of PEDs should be widespread.